metropolitan, all around New York City, the 5 boroughs in New York City. So I'm more or less in charge of Staten Island, and I live here, among other things. So last year we rescued and redistributed 61 million pounds of food, and we're planning to do even more next year. But it's not just that we rescue food and redistribute it to the food pantries. There's about 40 on Staten Island that we distribute to. We also have other groups. For example, we have the Healthy Retail Group, and the idea of the Healthy Retail Group is getting desirable, usable, and nutritious food into all the neighborhoods, especially places that are food deserts or food swamps. Has anybody heard the term food desert?
No.
It means basically...
There's no food. There's no food there?
No nutritious food. Food swamps are, there's plenty of food, but it's all like Kentucky Fried Chicken and McDonald's, not healthy snacks like these are, more or less. Also on Staten Island, there's the Staten Island Neighborhood Food Initiative, which I started with a group of people, including the Staten Island Partnership for Community Wellness. I'll get into that in a minute. But the idea of SINFI is to introduce delis to the neighbors and neighbors to delis. A lot of the food deserts on Staten Island, especially on the North Shore, there are these really wonderful stores, delis, bodegas, but people in the neighborhood don't want to go, they're afraid to go in them because the windows are in Sri Lankan or in Spanish or in Arabic. And so people in the neighborhood are like, well, am I going to be able to understand what they're selling? You know, am I going to be able to figure out what's in the store? So what we're trying to do is help people go to these stores, which have amazing fruits and vegetables, and feel comfortable in the stores, promoting the stores in their neighborhoods. And last year, actually, can you pass me that? Tottenville, the advertising group, we did we surveyed the entire island and asked people to nominate the stores in their neighborhoods. And I'll pass this around. It's basically a window sticker. So you guys did this. And if you look around, you'll see these in some of the windows around the island, and some of them in the neighborhood. But the SINFI has a couple of themes, one original and one after 4 years experience, partly this. We wanted to address racism and anti-immigration sentiment using food. So that's sort of the underlying idea. So isolation with food. Poverty means, well, what I wrote down, poverty means no cheers. You know, the TV show? People go to the bar and they hang out. If you don't have any money, there's no place to hang out. You know, there's no bar that you can go to. So a lot of people, we find that a lot of people are going to soup kitchens to hang out with their friends. You know, once a week, once or twice a week. They go to the food kitchens, the soup kitchens, and have a meal with their friends and other people. There's also social isolation of the fragile elderly. There's a lot of people who, sometimes the person delivering the food is the only person that those folks see that day. So the people who deliver the food are asked to make sure, first of all, that the person's there. You know, just don't hang the food on the door. And then if something's wrong, to let the office know. And there's been a number of, my husband works for them. There's been a couple times where he's gone in and there's one guy, Al, who he got up to open the door and collapsed because he had a diabetic reaction. So he had to call the office, the police, everybody else. But you know, these folks are delivering food, but they're also delivering health and preventing isolation. And then the other, the Apple, the stores, one of the things that we found out as we started to go to the stores to give them all their apples, is that what they were chosen for wasn't necessarily the food that they had, but just that they were welcoming. So I went into one place and I'm trying to give the guy his apple, and there's a woman coming in and she's plugging her phone in to plug in, you know, on one of the counters. And I guess she does that regularly, and it's like, that's okay. I went to Leo's Deli on Forest Avenue, And it's a very small place, but he has a table and a couple chairs, and there's these two old guys sitting there ragging on each other. And they do that every day. You know, so there's like, the owners of these stores are like welcoming people in. They're not just selling food, although they do that too, obviously. But they're making people happy insofar as they can. Other layer, the Staten Island Partnership for Community Wellness has a program called the Staten Island Child Wellness Initiative. So part of that, 39% of children in K through 8 on Staten Island are either overweight or obese. 12% of that are obese. And also 64% of Staten Islanders, 24 to 64, are either overweight or obese. And the problem with being overweight or obese is that it creates all kinds of health problems. So you get diabetes, you get heart disease, and this follows through your whole life. So what the Child Wellness Initiative is trying to do is get kids' weights to normal. And there's lots of reasons why kids are overweight, which doesn't necessarily have anything to do with willpower or anything else. It's just there's so much sugar available all the time in the environment, and kids are eating it and adults are eating it all the time, of things that make it really difficult not to become overweight. So the Child Wellness Initiative is working on some of those kinds of things, and we're going to try to work on that too. So this project for SINFI and City Harvest, we want to get some data on what middle school and high school students are buying now, and what healthier items might you be willing to buy if they were available in your local stores. So, and what we're going to try to do, we're going to do a workshop next week and answer some questions about how we're going to do it. We could do either a focus group, if you feel up for creating that, and we will show you how to do that, or you can do a survey, and using your phones basically, and SurveyMonkey or Google Forms, to find out what they're actually eating. What are they bringing from home? What are they buying for breakfast? What are they buying for lunch? What are they buying for snacks after school? Because with that data, we can go to the stores. We have relationships with a lot of stores, and not just here on Staten Island, but all 5 boroughs. We can go to the stores and say, look, a lot of kids said that they would buy whatever if it was in your store. Because store owners don't want to take a risk. They don't want to take a chance. You know, they're going to buy a whole bunch of yogurt parfaits, and nobody buys them. That's $300 down the drain. And the margins are so tight that they really can't afford to do that. So what we're trying to do is collect information rather than assuming, which is what people do, we have done for years, guessing, what people want. We're going to find out for sure. And that's what this project is going to be about.